And our team coverage continues with Avajoy Burnett. So Avajoy, the doctors at Walter Reed are slowly revealing more details about the medications that are being used on the president.
And Avajoy, what are they saying about the different treatments that the president has already received?
Well, Rick and Denise, the president has a very experienced team of doctors, and we know at least one of them is from Johns Hopkins Medicine in Baltimore. We spoke with a doctor who's not associated with the treatment of the president. He told us it's really hard to determine the effect, the long-term effect these medications will have on the president. As the president gets ready to return to the White House, medical professionals and the American public are wondering how the medications he's currently on will help with his recovery.
None of these individual treatments can really pinpoint exactly where you are and what in your course of treatment.
Dr. Kinjal Shott, head of Northwest Hospital's critical care unit in Randallstown, explained remdesivir could cut the length of time the president is sick. Dexamethasone, on the other hand, is a steroid that's intended to prevent his immune system from going into overdrive.
It can affect a lot of different things, and so it sets off a whole huge inflammation cascade, and which is why we've had patients who've had cardiac issues, neurological issues, and the steroids are hopefully able to blunt some of that inflammation.
Johns Hopkins physician Dr. Brian Garibaldi is on the president's treatment team.
Our plan is to give the 4th dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the 5th and final dose of his treatment course at the White House tomorrow evening.
When the president leaves the hospital, Dr. Shott says his battle against COVID doesn't end there.
It's a very fluid thing. One day they're doing well, and the next day they make it worse. And even sometimes when you're well enough to be discharged from a hospital, you can still have long-term other effects.
Now, as for the president's right to privacy versus the public's right to know how he's doing, Dr. Shott told us it depends on if this will affect his ability to lead. If it does not, everything else, all of the president's personal information will be off limits. Live tonight, Avajoy Burnett for WJZ.